Antisocial personality disorder is a condition in which an individual consistently violates societal norms, feels no guilt or empathy, and whose behavior is based on manipulation, aggression, and calculated instrumentalization of others. It is not about temporary impulses, but a deeply ingrained behavioral pattern that often begins in childhood, in the form of harming others, breaking rules, and showing no remorse. A person with antisocial personality disorder does not act according to morality, but follows a cold cost-benefit calculation. Rules, the feelings of others, and the consequences of their actions matter less to them than they do to most people. Such a person often displays charm, charisma, and persuasiveness, but behind this facade lies cold calculation and contempt for weakness. This disorder is not synonymous with impulsivity or physical aggression, although these elements may occur. The deeper core lies in the absence of a conscience, emotional emptiness, and the belief that one is above the law and above others. For an antisocial person, the world is a hunting ground. Relationships are merely a means to an end, and people are tools. Antisociality is a drama of emotional development in which the capacity to feel guilt, compassion, and responsibility has been halted. It is not only a problem for the individual, it poses a real danger to others, as a person with ASPD often not only suffers but also causes harm. And they see nothing wrong with that. A relationship with a person with antisocial personality disorder, colloquially referred to as a psychopath, resembles a slow descent into an emotional trap that is difficult to escape. In the beginning, everything seems ideal. This person can be charming, attentive, self-confident, and emotionally extremely attractive. They create the impression of an extraordinary connection, offering an illusion of safety and depth. Over time, the tone of the relationship changes. The partner with antisocial personality disorder manipulates, lies, exploits, and tests the other's boundaries without feeling any guilt. Authenticity disappears, replaced by coldness, lack of empathy, and unpredictability. Every weakness of the partner is noticed and later exploited, either for control or humiliation. Apologies, if they happen at all, are merely a tool to maintain power, never an expression of remorse. The victim begins to doubt their own feelings, memories, and perception of reality. The relationship is marked by gaslighting, induced jealousy, social isolation, and cycles of idealization and devaluation. The psychopath feels no real attachment. The relationship is a means to achieve personal goals: status, money, sex, control. When it is no longer useful, the partner is discarded, often with brutal coldness and complete lack of reflection. Such a relationship leaves deep scars, psychological breakdown, loss of self-worth, anxiety, depression, and sometimes post-traumatic stress disorder. It was not love, it was emotional theater, where one person acted and the other truly felt. The diagnosis of antisocial personality disorder is based on specific diagnostic criteria found in manuals such as the DSM-5, Diagnostic and Statistical Manual of Mental Disorders, and the ICD-10-11, International Classification of Diseases. A prerequisite for diagnosis is the presence of a pattern of disregard for and violation of the rights of others, beginning since the age of 15. However, a formal diagnosis is only made after the individual is 18 years old. Key criteria include persistent violation of social and legal norms, e.g. criminal behavior, chronic lying, cheating, and manipulating others for personal gain, impulsivity, lack of future planning, recklessness, irritability and aggressiveness, frequent fights or acts of violence, lack of guilt or remorse after causing harm, disregard for one's own safety and that of others, irresponsibility, inability to maintain employment or meet obligations. In addition, many individuals with this disorder exhibit traits of psychopathy, emotional coldness, lack of empathy, superficial affect, superficial charm, and a tendency to exploit others. The diagnosis is made by a psychiatrist or clinical psychologist based on a clinical history, behavioral observation, and sometimes the use of standardized diagnostic tools, such as the Hare Psychopathy Checklist, PCLR. It is important to distinguish antisocial personality disorder from other disorders and from individuals who may display antisocial behaviors due to factors such as addiction, trauma, or environmental conditions, without meeting the full criteria for antisocial personality disorder. Here are examples of individuals with antisocial personality traits based on real-life stories, though names are omitted. 1. Contract killer from Eastern Europe. He worked for years on behalf of criminal groups, eliminating targets named by his clients. He was calm, emotionless, and precise. In interviews, he described his victims without emotion and viewed murder as a job that needs to be done. He showed no remorse and regarded other people's emotions as a sign of weakness. 2. Cult leader from the USA. Through charisma and manipulation, he subdued a group of people who followed his orders without resistance. Over time, he orchestrated a series of brutal acts of violence. Although he wasn't directly involved in the crimes, he controlled them from a distance, with no empathy for the victims and no sense of responsibility. 3. Woman from the tech industry. For years, she ran a company based on false promises. Even though she knew her product didn't work, she continued to recruit investors, lied in the media, and exposed patients to risk. Even after the scandal was exposed, she admitted no guilt and claimed she had always acted with the best intentions. Still 4. Man from high-level finance. Over several decades, he ran a massive investment fraud scheme that caused thousands of people to lose their savings. Calm, eloquent, and socially respected, he concealed the scale of the fraud until the end and showed no remorse. 5. Thief from South America. He specialized in manipulating women. He seduced them, stole their savings, and then disappeared. He was able to gain trust, was eloquent and convincing. When one of the victims tried to get her money back, he publicly defamed her and portrayed her as insane. 6. Police officer who played both sides. For years, he officially fought crime while simultaneously working with gangs. He manipulated witnesses, destroyed evidence, and ensured his own impunity. When the truth came out, he defended himself by claiming he had acted for the good of the public. Each of these cases illustrates different faces of the antisocial personality, from cold brutality to subtle, emotionless exploitation of others. The common traits are a lack of empathy, absence of guilt, and a deep-rooted belief in their right to break social norms. Antisocial personality disorder is a condition characterized by a persistent pattern of disregard for the rights of others, impulsivity, aggression, and a lack of guilt or remorse. Treating individuals with this disorder is extremely challenging but possible, especially when the patient shows a willingness to change. The most commonly used therapeutic approach is cognitive behavioral therapy, CBT. It helps individuals with antisocial personality disorder understand how their thoughts and beliefs influence their behavior. The therapist teaches them to recognize situations that trigger impulsive, aggressive, or manipulative reactions and how to manage them. A crucial element of therapy is also the development of social skills, such as empathy, cooperation, and managing frustration. However, motivation for change is often very low in people with antisocial personality disorder. They frequently fail to recognize the need for therapy or the negative impact of their behavior. Therefore, consistency and patience from the therapist, as well as the creation of an environment with clear rules and support, are essential to gradually increase the willingness to cooperate. Support for family members and close associates is also of great importance. Relationships with individuals who have antisocial personality disorder are often marked by tension, misunderstandings, and emotional strain. Family therapy helps identify patterns that may reinforce negative behaviors and teaches how to set healthy boundaries to protect personal well-being. Support groups for families not only provide knowledge about the disorder, but also offer a space to share experiences and emotions, reducing the sense of isolation. Education is crucial for both affected individuals and their families. Understanding how antisocial personality disorder functions helps prevent the escalation of conflicts and promotes healthier communication. This, in turn, supports the therapeutic process and contributes to improving the quality of life for the entire family. In summary, therapy and support for individuals with antisocial personality disorder is a long-term process that requires the commitment of many parties: the patient, the therapist, and the family. Although change is difficult, it is possible through appropriate therapeutic methods, patience, and intentional work on relationships. Support for loved ones and education not only help in understanding the disorder, but also in creating a healthier and safer environment for everyone involved. What is antisocial personality disorder? It is a disorder characterized by a persistent pattern of disregard for the rights of others, lack of empathy, and violation of social norms. People with this disorder often break the law, lie, and manipulate without feeling guilt. Are people with antisocial personality disorder always criminals? Not always. While many do break the law, not all are offenders. Some can function in society, even though their behavior may be destructive to others. Do people with antisocial personality disorder feel emotions? Their emotions are often shallow or superficial. They may not feel guilt or empathy, but that doesn't mean they are completely emotionless. Can people with this disorder change? Change is difficult because they often don't recognize the problem. Therapy can help if they are motivated, but it requires time and professional support. What behaviors might indicate a possible antisocial personality disorder? Frequent lying, lack of respect for others, ignoring rules, impulsivity, aggression, irresponsibility, and exploiting others for personal gain. Are people with antisocial personality disorder dangerous? They can be dangerous, especially when impulsivity leads to violence. However, not all are physically aggressive, even though their actions often harm others. What does therapy for antisocial personality disorder look like? It usually involves psychotherapy, focused on changing thinking and behavior and developing social skills. Psychological support helps the person understand the consequences of their actions. Can you trust someone with antisocial personality disorder? It is difficult, as they often manipulate and lie. Trust requires time and consistent monitoring of their behavior. How should you deal with a close person who has antisocial personality disorder? It's important to set boundaries, not allow yourself to be manipulated, and seek professional help to protect yourself and others. Does this disorder affect men or women more often? It is more frequently diagnosed in men, although women can also have antisocial personality disorder, often with less overt behavior. Can children with behavioral problems develop antisocial personality disorder? Yes. Conduct disorders in childhood are often a warning sign that antisocial personality disorder may develop in adulthood. What should you do if you suspect someone has antisocial personality disorder? It's best to encourage the person to seek help from a psychologist or psychiatrist. If there is a risk to others, the appropriate authorities should be informed. Antisocial personality disorder is a serious condition characterized by a persistent disregard for the rights of others, lack of empathy, impulsivity, and a tendency toward aggression and manipulation. Individuals with this disorder often act without guilt, making it difficult for them to form lasting relationships and leading to conflicts as well as legal and personal problems. The behavior can take many forms, from covert manipulation to open aggression and violations of the law. They often struggle with close relationships, although they may appear charming, which makes it easier for them to gain and exploit others' trust. The causes of this disorder are complex and include both genetic and environmental factors, such as a traumatic childhood or a lack of emotional stability. Early experiences shape difficulties with empathy and impulse control. Diagnosis requires professional assessment based on the observation of behaviors that have been present since adolescence. Treatment is challenging and depends on the patient's motivation. Cognitive behavioral therapy helps to change destructive thought patterns and behaviors and to develop social and emotional skills. Support for families is also important, as relationships with affected individuals can be stressful and full of tension. Family therapy and support groups help in understanding the disorder, managing emotions, and setting boundaries. In summary, antisocial personality disorder is a complex condition that significantly impacts the life of the individual and those around them. Proper diagnosis, therapy and support offer a chance for improved functioning and rebuilding of relationships, but require time, patience, and the commitment of all involved.